I'd like to turn this over to Bill Eide. Bill is a research scholar at the Center for Health Systems and Design and has had a lot of experience in healthcare facilities planning and design. So Bill, have at it.
Thank you, George. Thank you very much. It's a real honor to be asked to make this introduction of a very fine world-class organization. One I actually have had the pleasure of working with, and so I know a little bit about them. HDR is out of Omaha, Nebraska. That's where their headquarters are. It's a firm of about 10,000 people with 200 offices, 190 offices actually, if we're getting accurate. 154 of them in the United States, with offices in Canada, Asia Pacific area, Europe, and Middle East. So pretty well got it covered. People speaking today are all out of the Dallas office. It's one that we've worked with and know well. 2 out of the 3 are Aggies. So it goes without saying they really know what they're talking about and are probably the best of the crowd. The third one is if I may take the liberty of calling it a junior Aggie school, Iowa State University. And I can say that because I'm from Oklahoma State University, and that was a junior Aggie school too. The speakers today will be Stephen Knowles. Stephen is an architect, been around for a while. He is the Iowa State University graduate, been involved in numerous projects, believes in a collaborative process, and he advances innovative solutions that integrate the site, surrounding resources, craft, and local culture. I think that's the first time I've seen the word craft used in describing one's work. So I'm really interested in seeing what he's got to show us. Joining him is Dan Thomas, who's a health principal at HDR in Dallas. 26 years of defined architectural experience in healthcare. He is an Aggie also. His approach, which he has applied to a diverse portfolio of award-winning healthcare projects around the world, include the new Parkland Hospital in Dallas, I know integrates the approach and the desire to do research into the program. And that's what Dan and I had the privilege, well, I had the privilege of working with him on a project this last year that documented the care providers' reaction to the COVID-19 pandemic. I think that study is going to be released here pretty soon, I think it's being copyrighted and printed, and it should be coming out general purpose. It was a great honor to work with Dan. I got to sit and watch mostly. It's always fun to watch other people work hard, and I enjoyed that a lot. So we go with that. Speaking today, starting the program, is Crandle Davis. He's the health principal with the HDR. He is an Aggie, class of '86. He's a principal in charge of many healthcare projects, and he works to ensure client relationship. So he's on top of things. With that, I'm going to turn it over to Crandle and let him pick it up and give us all, make us all just as smart as we can be. Thanks.
Thank you. Thank you for those. Yeah, thanks for those intros. I think Stephen's going to drive the show for us today and share a screen with a couple things. Good to see everybody. Appreciate you guys joining us. I'm going to slide you guys over to this other screen here a little bit. Well, just Bill, thank you for the intro of our team, and also Professor Mann, thank you for the intro of our firm. We do have a couple slides here, just to intro to HDR, and then we will jump right in. So, Stephen, we are going to talk about our some discussions about telemedicine, which I know that everybody is experiencing in different ways now. We are a year long into this pandemic in the States, and what the way it has changed our shifted us in the way we interact with each other as well as organizations. So go ahead, Stephen. So a little bit about HDR. You met the individuals that are here representing HDR today and will be speaking. I have been a member of HIAC along with Dan for many years, and we appreciate the opportunity to be here. The information that you see in front of you was also offered by Bill in his intro. We do have 10,000 people that are members of HDR. We, on the architecture side, are closer to 2,000 of that. We have an engineering brethren in our firm that does what we call heavy engineering and horizontal engineering. And then on the architecture side, we focus with architects and engineers on buildings, of which you can see our rankings with regards to healthcare and the amount of healthcare work that we have done in the last 5 years as well, square footage and construction value. So we're a 100-plus-year-old firm, and very proud of that organization. So it's been a good organization to be a part of for me, for sure.
Crandle, I'd like to share with the group that, HDR, what's really different about HDR in most firms is we're employee owned. So that changes the culture, because everybody that's a part of the firm has stake in the game from the beginning to get. So, the guy that's helping us in the mail room to our assistants to everybody is an employee owned firm and a part of the firm. So
yeah, good. That is a good differentiator. So telehealth trends. There are, Dan and I are going to talk about this and kind of co-share this information. So we're going to ping pong a little, but wanted to speak to you guys about what we are seeing and some of the direction that these are going in, and who hasn't had a interaction at this point with a doctor or a physician, whether it be through email or through an actual telehealth visit.
I think
I actually had one with a dentist, which was interesting when you think about the dentist and how that might go, and holding a phone just right so they can see an image of your mouth. But that happened through the early several months of the pandemic. So go ahead, Dan.
No, I was just going to say, I think one of the benefits of the pandemic as it pertains to health is it has forced our healthcare systems to actually embrace telehealth. Up to this point, physicians and staff are kind of, uncomfortable, and what is the perception of the patients and families, and how do we work this out? And I know Bill and I, interviewed Christus, and that was one of their big things. They went from 200 telehealth visits a month to 4,000 because they had to embrace it and use it. So I think, the question here is really, we're seeing the trends being implemented, but then the big question is this dichotomy between the patient touch and being able to create that experience from a telemedicine standpoint and action between the physicians and that exam visit to actually coming to a waiting room. And so I think that's the big question that we're going to really talk about today, is really how are we going to find the balance between, using telemedicine and then actually being in person and being treated. So go ahead.
Yeah, and some stats that go with that. We're seeing 85% in of the behavioral health visits today versus 48% in the mental health side of a telehealth visit. There was even an increase that Blue Cross Blue Shield had noted that happened from 1 year ago today. That's a 3,500% increase in their behavioral health telehealth visits. So this is something that is going to continue. They're seeing it as a little less than $50 billion of the market prior to the pandemic, and expecting within the next few years that it could be almost a $200 billion portion of the market. So we are going to see this continue, and as we design for these spaces, that's what we'd like to chat with you guys about some more today.
Yeah, so the slide that we have up here today is really from the advisory board, and just kind of how the telehealth is impacting the delivery of care from, everything from our devices to cameras to video or smartphones. My physician which I think I have a better relationship with my physician now than I did before, because I can literally pick up my cell phone and text her and say, hey, I'm feeling, have these symptoms, and she can get back with me within 30 or 40 minutes. But we have to have the infrastructure and we have to have the systems in place in order for that to happen. This is a special group of physicians in Plano that have embraced it, and so it's made it easier on us. So it's not only technology and space, but it's also how we have the system set up, the operational platform to really use our telemedicine to its best advantage for the patients and for the staff. I was asking her, because I was in there a couple of weeks ago, and I was asking her, has it really helped you delivering care? And she says, actually, it's allowed her to reach out more to her patients at a quicker turnaround times, and be able to be, working with her patients more than it was before. So we're seeing the benefits, but then there's also the downside, because we're not, if you don't feel comfortable, like Crandle was mentioning, taking photographs of yourself and interacting with the devices. So we're seeing that dichotomy between the two. You can go to the next slide.
Well, before you slip out
Feel
of there,
feel free to ask any questions. It's an open dialogue. So
just a real quick stat on this. You see established, emerging, and experimental, and the flow of where this platform and the capabilities of where it's moving in the horizon. There are some stats there that are saying that even with as much advancement as we've had with technology, there are still things that are going to hamper some of this, including the availability just to have the broadband in our rural areas that we're supporting. And those things are still presenting some challenges that we have to find ways to overcome, with some ideas as we walk further into this presentation that'll help show some potential for that, how to resolve that as well. I think this slide where it says patients are definitely probably willing to try this. If you can see the advisory board date on this is 2019. Well, they are definitely willing to try it now. So we have already eclipsed some of this while we are moving into the area and time frame that we are today in designing for these spaces.
And I think that's the biggest issue, is how is it going to impact our space and our planning? And we'll talk a little bit about that as Stephen talks about one of our projects, but really, how are we building the platform so the physician or the mid-level can step out of the clinic and go into these rooms, or is it part of the clinic so that you can access the telehealth, telemedicine devices, so that you can set within an exam room or an office and be able to administer a virtual visit.
Mm-hmm. Good. Yeah.
So one of the things that we're seeing, and this is in China, and I think one of the we were working with Rush, and these I'm not really comfortable with this yet, but these 24-hour ATM clinic visits. You just you've got the pharmacy on one side, and then you've got the actual booth that you can go in and connect with your physician. We have the minute clinics at CVS and Eckerd's, and so this would probably take the place of that, or it could be alongside the CVS's or some corporation that can actually can administer this. We are not seeing this yet in the domestic, but we are seeing it in China and other parts of the world. And I think this is some of the emerging technology and emerging solutions to that telehealth visits.
We've seen some of these over the years. I mean, who hadn't been at Tom Thumb or HEB and slid their arm in a cuff to get their blood pressure done while they're waiting for a prescription to be filled or something. But that's taking all of those things that were passive, so to speak, in their technology and putting them together in an environment now that could be these kiosks, these pods, either outside or airports, schools. The application of these is rather endless.
Go to the next slide.
Yeah.
So, how do we plan for these within our spaces? Are we going to, we can see these within, our waiting rooms for new ambulatory care facilities. It could be adjoined to that, or it can be placed within any community centers. So how do we adapt our it's really adapting our thinking to delivering of care, because these are going to be remote pods or units that we could use to connect to with our physicians and our care.
There's some specific things in there that are being studied, and how that space, even with if it's in a room or if it's in a pod, is being designed as well. You've no doubt been a part of plenty of Zoom calls and WebEx meetings where something in the background has been a distraction, that hence the pod and the ability to focus for not only the patient and the caregiver, lighting, those things, that even the color that is being used as paint, and camera location, and all of these things are going to be further tested and understood, but we are seeing some of those things being innovated even now, as we have drifted further and further into this with the connectivity.
So are you seeing this implemented in the interiors more like in a wellness room per se?
That is one option, yes. We have some case studies with Penn Med and Northwell Health, and Dan mentioned Rush, and then one of the innovators of this really was Kaiser. And you think about their health hub, and what really started this discussion with where we're headed today. This has been a fast track, to get to where we're at now, and the discussions we're having. But they were pioneering this when they were reimagining ambulatory health and their health hubs, 8 years ago, 10 years ago. So yes, and even a center, we have a case study in New York where the 9th floor was taken to create a telehealth center, and it's about it's almost 5,000 square feet, and it can accommodate 20 or so providers, and it's strictly for that telehealth connectivity.
So then we'll transition over. Go ahead.
Go ahead. No, go ahead.
We can just transition over to Stephen, and he's going to talk a little bit about a project that we're working, a community project out in Lubbock.
Thank you, Dan. So I know everybody's been talking about the kind of telehealth and the kind of virtual that's been a big part of, I think, the drive in the last year, especially for healthcare and how we're trying to reach out, or these systems are trying to reach out. On the other side of it, so from a regional standpoint, our team has been working with University Medical Center in Lubbock with their healthcare system there. This is a project that actually is really more about high touch. It is a healthcare system that has been kind of growing. It's got a campus. It has certain kind of restrictions. The HDR team's planning group had done a kind of a master plan looking at their main campus. As you can see here, there's this facility, like most of what we see over there. It's, got precast buildings. Things have been kind of lined up. They've done small incremental type of fixes that maybe solve short-term needs, but they haven't really had a kind of long-term plan until they kind of reached out to our team. And so in that, we started to look at what their facility, how they could reshape the program that was inside the building, but then what are things that they could start to add to kind of really enhance how they service the kind of Western Texas market. The other thing that came out of it is, of course, the regional growth that was happening in Lubbock was moving towards the Southwest. And so there again, I think the types of services that they were looking at expanding, did it make sense to do them on the main campus, or did it look like a better solution to kind of maybe have a satellite? So I think when we originally had the conversation, it was really going to be an ASC kind of, really surgery services, other kinds of things, no beds. As we started to look into the program, we started realizing maybe this needed to be something that's really integrated into the community at a much more, at a higher level than just providing some additional services, healthcare services. So the team, they identified a site that UMC had purchased out there. There again, it's a very commercial corridor. It really kind of ties back to this connection to this another kind of big loop road that they're actually doing around Lubbock right now. And so how they could start to service the homes and families that are out in this particular region. It's an interesting area. I mean, the people, if they feel like they have to drive more than 15 minutes, it seems it's too far away. So they do like to have things distributed a little bit more in the community. So we were working hard to kind of figure out what that meant. Our design team, of course, looked at the kind of regional character. There again, the landscape, it's very strong agriculture. I mean, a lot of our cotton that's used for production comes from this region. So, you know, there's a lot of qualities that we really wanted to kind of hold on to because they knew that they wanted this facility to feel like a regional hospital, but build a kind of new identity. The team also started to look at what are some things that we would bring that we don't see in the architecture there that could be, I think, an enhancement. So this connection between inside and outside. We talked about materials, transparency. How do we start to handle, you know, the kind of Texas sun and sunset, you know, and with glass and energy performance. So all the things that are kind of very important to HDR's building architectural and design development. We wanted to kind of share what those things could do to help their project. So in the kind of master planning, we knew that there was started out as an ASC that eventually became a hospital. One of the things that was really important is to develop this hub that is kind of a public space. And then one of the things that came into it was, you know, we had physicians that we wanted to accommodate. So that would be a, getting some background noise. But the public space really became kind of a hub. And then one of the things that UMC was thinking through is the idea of a kind of a wellness component. And so wellness in their mind, you know, as they started to think through this was we had rehab, which is kind of an outreach into the community, but then they also had fitness. And so they were starting to have these conversations with people that could bring a kind of a fitness component to the conversation. And so there again, it's preventative health as well as kind of healthcare services. So in doing that, we started to kind of mass up with these things, looking at future growth. What would that do on the particular site that they had? It seemed like it was a good sized site, but you know, as you start to realize on all the program and parking and things that would be required, the team really started to think through some of these issues. And then of course, what would be the future growth, because UMC was really starting to build a kind of a campus with other partners that would come out to this site. And so how they would acquire land and to help support that was also going to be important, or was relevant to the discussion. You know, some of the initial sketches was really starting to think about this public space. You know, is it an outdoor space? Can it be a kind of a community gathering? We had coffee, other kinds of things that people not just coming there for healthcare services, but also feel like it was a community place to kind of hang out and do things. The landscape was inspired by the kind of changes that we see in the region, you know, the growth and everything green and lush at one point, and then of course the cotton and the transformation throughout the year. So things of color and textures were important to the team. So they started to kind of think about these things and did quick little studies of what would that feel like. And so these things were always developed to have the conversation back with UMC to help them kind of map out where the future of how they wanted to do kind of a high touch healthcare service. As we started to get into the design, so right now the project is only at a schematic design level. So I would say, William, the craft is not quite there yet. We have thoughts about it, but we haven't really have anything to show that. But we'll look forward to bringing this back to share in the future how we put this building together. But one of the big things is the story of the kind of how we were kind of connecting to the community. What were these ways in which the building would kind of frame itself? And so the theme as we developed, we worked with 3 themes. One was what we call the porch, which is basically the place, making a place for people to congregate and meet with each other. Another one was more the kind of atrium. This one was really about kind of a central space that everything would work off of. And then of course the landmark, which was, really was more about the building being a kind of an icon in the community. So they're again, trying to maximize height and other kinds of things and how that would work. So these different things started a conversation with the client to kind of, as they started thinking through, how do they want this experience, the patient experience and the user experience to work here. So with the porch scheme really was a kind of, do we have a kind of a circulation link that we could have activities in that would tie these main elements together? It really kind of broke down into three. As I mentioned, the kind of ASC and future growth in a shell, the medical office building, and then of course the health and wellness component. And there again, that would face Slide Road, which was going to be a major highway. And so how was that whole kind of entry experience and its identity from the road start to set up? And as you can see, to the south of the facility was a you can tell it's kind of in the middle of nowhere at the moment, but it's, it's a storage unit. So there again, how do we start to kind of do something that kind of enhances the neighborhood from what we have there at the moment? And there again, quick studies that the team would do to kind of say, well, what would that experience feel like? What are the colors and textures of materials? How is glass and daylight and other things kind of brought into this? And so we would do these things to get it back in front of the client, because as we have found a lot of times that it helps them to kind of visualize by seeing something, at eye level, what would that be? So we do a lot of diagramming and sketchal drawings and stuff like that. But we ultimately, when we try to communicate back with our clients, we try to visualize as much as possible through models and also through these kind of renderings. And then as we went through, we started talking about some of the kind of values. So, there's data that's kind of back behind this stuff. So we would talk about if we did go from the porch to the atrium idea, how the kind of stacking of the program, one starts to reduce footprints, but also starts to set up some different kind of relationships that maybe weren't there before. And so we would talk through those scenarios with the UMC and get their feedback of how they want this to work. And then, of course, from the atrium to the landmark is really kind of stacking it even more to kind of get some additional heights and develop different kinds of relationships. So there again, we were able to kind of go through this kind of value system with them by setting up these different scenarios that make sense for how they want to operate this building. And then of course we would have data and information that would come back and help us say, there's a potential savings of square footage and other kinds of things, which they knew tied to cost, but also kind of relationships. And so they would go through this and not necessarily pick what would be the most optimal from an efficiency standpoint, but maybe what would make the most sense from how they want to drive and operate this facility. And there again, we would go talk about future expansion. How would that be impacted? And then ultimately, they didn't pick an A, B, or C. We ended up kind of doing a hybrid, which was kind of the idea of the porch or the big front facing towards Slide Road, and then also the kind of lobby and how that lobby would be the kind of hub for these different facilities. So then, the team would quickly kind of, how does that mass up? And it's a big front door. And some of the things that the client would come back and they would give us some feedback, and they said, well, they like the idea of this. And so we would talk about the community hub. We talk about the kind of meandering paths that the community would have when they were coming to this facility. And then what are some of the things, we have a kind of a teaching kitchen and classrooms and a pharmacy and childcare and of course fitness. And how are all these things kind of a resource to the community, and how would they be kind of managed and ran in such a way so that they became a way of looking at a holistic or a kind of wellness perception of how to be in this community. Team would just make quick sketches and say, as we're layering these things, what could you see? So there again, these are all real schematic, just trying to get some ideas passed. Sometimes we don't try to do everything in renderings until we get to a point where we feel like we're not trying to do 50 different solutions, but we start to dial it in a little bit more.
So this would be, if you go back to that slide real quick, Stephen,
Yeah.
This would be one more. This would be where we would integrate that the kiosks and the telemedicine access for our patients and families. And also the way we've designed this from a community standpoint is that we have access to all of the retail and the pharmacy, and that main area can turn into a community space that the community can use on off hours for education and teaching. But like I said, this would be where we would implement those kiosks or those little booths that we were talking about earlier.
I've got a question. Looking at the site plan, there's a lot of surface parking. Did you consider parking garage and allowing more green space around the hospital?
So that's a really interesting question. So yes, so we talked about that where, so right now the surface parking, we have some retention and other things that are kind of associated. Because of how the community wants to budget this, everything is kind of being treated as surface parking because a parking structure would be part of phase 2. And so so right now they're trying to do everything with the surface and what we're doing there. That's why we're very protective of what we call the kind of wellness garden. And you'll start to see that a little bit. And then we're also identifying kind of areas that we have green space. When the expansion starts to happen, there'll be other, a parking structure will be required. What's nice now is that Lubbock is going through changing their zoning requirements. And so that will start to take some of that kind of restrictions on parking down. But then we also have to balance, I mean, this is a very strong auto culture here in Lubbock. And so we want these facilities to work. It's always, so we have to make sure we can accommodate all the different situations, because it will be similar to a lot of these kind of retail centers and other things that we want people to come here, and they'll probably be participating longer than just coming for a visit to a physician. So there again, the parking has got a huge demand on it, but it is going through a lot of discussions right now with the city, because I know right now their parking requirements are, I mean, for this size of facility, it's around 1,000 cars, and that's pretty, for a small facility like that, we're a little bit surprised, but we're working through that kind of stuff. But like I said, we're in schematics. There's so many things up in the air and being discussed right now, which is great. And that is actually one of them that's come up many times. And then I think the one thing, kind of back to what Dan was saying, is that I think the telehealth, I had a long experience involved with these kind of large scale resort projects. And there again, I think the idea that you're thinking about visiting this facility will probably start with looking at your app, tapping in, making an appointment, or doing different things. You're having that kind of a digital interaction with this facility before you even have a physical one. But there again, I think these are going to start to enhance each other, as we're starting to see in the last year with the higher use of digital technologies. And so we're going to see a lot of, I think, transformations with regards to how you interact with the physical space, and I think making that more convenient for you. So we're not looking at a bunch of waiting areas for people to wait for, while you have to go, but actually looking at it more as this is a kind of a touchdown spot for you to go. So if you come and you want to sit and have a cup of coffee before you go in, as opposed to waiting in a lobby because you have your appointment set up, those are some of the things we'll start to see that'll change the whole kind of user patient experience that we're trying to develop. Anything else, Dan or Crandle? Okay.
I actually have a question. I'm so sorry. This is Danielle Smith Wilder. I'm a graduate student at Texas A&M. I actually had the pleasure of living in Lubbock for this past year before coming back to complete my master's program. And Lubbock is such an interesting place. I think that there is so much that has to do with the regional culture, and simple changes maybe take a long time. I love that this is a project in the schematic phase, because y'all are currently, dealing with interacting with the community and understanding their needs and their desires for this space. I mean, the Buddy Holly Center that was just recently opened was sort of a shock to everyone, and we're starting to see what Lubbock can become. And I think that it's really exciting, especially when you talk about healthcare and wellness and that integration. So I was curious, you've talked a lot about bringing in the elements of, a landmark and the front porch and the community sort of integration. And I was wondering what it has been like to bring, members of the community into these decisions. If there have been focus groups or anything like that that have promoted some of these ideas.
So UMC's been having some conversations, I mean, with the community, with their leaders, and they've kind of brought that information to us. I know some of our initial research that was done so HDR has a kind of a research team and does kind of a data analysis of an area. And so there again, they were tracking a lot of different things, needs that they were starting to get from kind of assessments and feedback that they were from, I would say, questionnaires and other things in the community. We haven't had that direct, HDR with this particular project hasn't had the direct connection with any of these kind of groups, but I know we have 2 planners that are kind of leading the effort and are having conversations with all these different groups. And then, and of course, they have their connection back to the community. And so there's this kind of layered conversations that's been going on. So it's been pretty exciting, and that, you know, there again, the feedback and the changes, because the building really has gone through a big transformation, because originally it was just a simple ASC facility with maybe some medical office building, and it's grown into this really offering the kind of fitness and wellness components, the rehab, other things that they knew that the community wanted to bring there. And they're also thinking about it as a place for the community use, you know, as I think Crandle and Dan maybe have said, that people could come here and have an event. So the therapy garden was really a garden that could be an event space for things, you know, in education, and then they would have an event that would support the community. So they're looking at all these things that are kind of public outreach. So they want it to be more than just a place to visit for healthcare services. But like I said, schematic design, I know we have a lot more conversations, but they're very excited about trying to make this something more than what we've seen typically with these kind of satellite facilities.
Yeah, absolutely. So sorry.
Oh, no, go ahead, Danielle.
I was just going to say, this city doesn't have something like this. I worked downtown for that year, and even walking across the street to get some coffee, you were a little scared, hesitant to step off the curb because of different, you know, not very walkable spaces or green spaces. So this is exciting.
Yeah, I've experienced those same, you know, you've got to be careful about how fast that truck's coming around the corner.
Right.
So. But, you know, so even in some of the site plan drivers too, because, you know, we talk about the building, but it really is kind of integrated into a bigger discussion. You know, there again, the kind of whole main entry lobby, which I would kind of reference as a hub, the garden, you know, what is the growth potential out there? So, you know, it does look like it's a sea of parking and a building, but it really is trying to figure out how to expand and maintain that kind of front door to the community, but how is this campus going to grow to the east? You know, they talked about health and wellness paths, you know, there again, how can you have walking paths that go back into the neighborhoods? Also, you know, as the facilities grow to the other way, can they do therapy sessions that are outdoors and indoors? You know, Slide Road is very important to the community. It's a main corridor. So there again, you know, its identity. But then also, you know, these facilities have a lot of entry points. You know, if you're coming for infusion therapy, or if it's an emergency room visit, each one of these has a kind of an experience that is tied all the way around the building. So we have multiple points of entry, even though there is kind of a main. Even the kind of pharmacy pickup, you can either go inside and have a face-to-face interaction, or you could do a drive up and come up through a kind of a kiosk. So you don't have to have that face-to-face, or you have to quickly pick it up because your children is in the back and they need some medicine, and you don't want to go inside and try to drag everybody in. So they're really thinking through all of these different things as a community member, what they might need at this particular facility. So some of the design things that start to kind of tweak, you know, we start to think about the geometry. How can we, you know, as we organize this, can we do little things that open up the kind of garden? How can we shape that kind of entry experience? So there again, how these pieces come together become really important. And it's funny, it's just some of these little subtle moves can have a huge impact on how spaces can start to shape. We also start to look at how the expansion, so, you know, is it the hospital that expands? You know, then what we need for parking, the opposite would be maybe it's medical office building expands, and then parking would grow to support that, or, it's a combination of things. And so this is, but there again is how the building shapes start to also engage the campus that would be to the east. And then again, when we start to get to the next level, we start to think about how that space is between inside and outside, that relationship, so that these experiences are not just about sitting in a room, with a couple windows, but we really want to make this feel open and airy and a part of a bigger campus feel. And so, right now we're looking at a kind of a 3-level facility. As you can see here, the main floor has, some things that were more high touch. With the lobby, we would have a kind of food service that would be part of that, be adjacent to the fitness facility. The fitness facility has a whole different bunch of programs that they'll be doing, which will be kind of fun to be able to show as we develop this further. But from high-tech fitness stuff to simple cardio to yoga studios. And so those relationships to the garden will be important. Then of course the lobby will be kind of a multi-use space. They can utilize it for events and other kinds of things. And then of course pharmacy and labs, all those things become really easy access for people that come in for maybe a short visit or need something. So you can see the kind of layout, and then of course surgery becomes a big part of our second floor, our rehab and our MOP. The lobby really is a kind of a 2-story space, so they're a kind of a visual connector between everything, as opposed to trying to have you go through a corridor. And then of course the medical office, so they refer to them as plazas, so that's why it says MOP, not MOB, so that's not a misspelling. But the medical office plaza, and then the shell, which is future growth for, could be beds, it could be other kinds of services. So they're again trying to build some flexibility into a facility, knowing that you don't know everything, and by the time the building starts to be built, we've always seen that a project will end up having, all of a sudden, I wish we had built that another 200 square feet or 2,000 square feet, because we could have used it for this one service. Our planners are really good about understanding what could the potential for future need. And of course UMC, even in their main campus, has already run into that. They have 3 floors of a building that were completely empty, and they were filled up immediately. So they're already realizing that they could have made some other decisions early on, that they don't want to shortchange the community by not having something available. And then so I think
Good question, if I may.
Oh, go ahead.
On the second floor, what's called inpatient, are those beds, patient beds?
Those are patient beds. So that's the difference of when it became, instead of being an ASC, they decided that they did want some beds at this particular location. So we only have 6 at this point in time.
Okay.
There again, so now it became a remote hospital, just because of how they're trying to provide services in this particular location.
Yeah, it could be your 23-hour stay or 24-hour stay, ortho, it can flex between your.
About CMS and reimbursement. Is it? I know with an emergency center and not having beds to support it can be a problem.
Mm-hmm.
With CMS.
Yeah.
Okay, well,
And that allows that. And if you can see the inpatient, we can expand that into the shell space too. So it's really being flexible to accommodate that.
Yeah, I know. We know that healthcare facilities have a tendency to be, fairly programmed intensive projects, but we're also learning to what we call develop a loose fit, and because we know that a lot of times things are changing and growing and shifting all the time. So even the beds, which was not part of the original discussion when we started out of the master planning process, the beds came in later because of some of scenarios that they started to plan out and realize, oh, we can't accommodate it. And so, there again, that discussion, is it 15 beds, is it 3 beds or whatever? And, I think the minimum they wanted it was 4, but we ended up with, I think 8 or 6, it was between 6 and 8 was the discussion, but I think we're at 6 right now.
Great, thank you.
Mm-hmm. So, I think that some of the big things, the kind of back to the kind of site plan drivers at the moment for the schematic, they're again that kind of hub and the kind of porch and how you connect all these different kind of services, that garden, of course, the landscapes to facing towards Slide Road, and that whole patient experience of being dropped off and picked up is important. We've got ambulances and services to the south. We know that the development to the south, there again is going to be screened and so forth. So, there again, it's probably the only place that feels like almost the back of house, even though it's facing south. But we're trying to screen and do things with that, because even the east side is more expansion, would be the campus. So there really is no backside of this building. So every side has to be kind of thought through with regards to how the facility is responding to the different needs. And there again, yeah, this is just kind of a picture in context. So you can see the residential that's starting to grow to the east and wrap around. So there's a kind of a campus that's being developed to the east, and then the blue area is actually property that UMC has purchased, therefore being able to kind of set up other partners that could be part of the relationship of this facility. And then, of course, we're still waiting to see what's going to be handled to the south with the, we know that the storage units will probably go away. It'll probably become some kind of retail center. But there again, I'm sure UMC will be working with the landowners to work out what would best suit for both of them, help each other out to make this a great corner for the community. So, of course, we're always thinking through materials. There again, we look at things that from a cost standpoint, but also from, the kind of material and feeling of quality that they want at this facility. And then what we start to kind of paint what that would start to look like on the facility. So there again, our schematic design packages throw a lot of information in, even though we're probably still in a lot of development to go on, but we're trying to understand, how's that front porch work? How are these two facilities that are kind of linked through this hub? The emergency and ambulance areas, how those work. This is even an older one where the service, where the loading docks have now been integrated more into the building, and they're not just added on, but every time we develop ideas, we put it into the model and then start to finesse it until it starts to be very integrated in. But there again, the team's thinking hard about mechanical systems, building systems, how are the relationships and all that stuff. And even though it's schematic design, there is a lot of things that are put into place so that we can understand what we need to do next. There again, even the kind of how that garden and that relationship between those two buildings becomes integrated back into the lobby. So we're thinking about not just the building, but the inside-outside relationship, along with the kind of programming that would be on either side of that facade. And then, again, they kind of, 110th Street, this kind of corner identity as people are coming from kind of Lubbock to the south. What is that impression, seeing the fitness center and the medical office plaza. So then these are just some views that we did. So there again, the glass isn't transparent, so it'll be a much more transparent building than what's showing here. You'll be able to see a lot of things that are going inside and outside. We're working through performance of the glass because it does get that sunset sun that it's going to have. So we'll be thinking through glare and other kinds of issues. So how the glazing is thought through from a high performance standpoint. We've been doing things with Fritz and screening materials and other kinds of things that will add another kind of level of identity to the facility. There again, those kind of outdoor spaces and that experience of coming and being dropped off is kind of a big part of what we're trying to do. So this is kind of where we're at. We've got a construction manager at risk on the project. So now we'll start to get some numbers associated with it. And we've identified probably another 179 different other items that we need to start to kind of address as we move into what we call the design development phase. And as we still work with the community and UMC and then also the city as they're going through a bunch of their changes in zoning requirements. So that's what we have for today. I thought we can open up for discussion, and I can go back to any particular slide if anybody has a question about anything.
That was a wonderful presentation, and seeing a building presented in detail, I think, is invaluable for the students.